Tour 2025 Hartford Healthcare Women's Championship tees off this Thursday. But today, Hartford Healthcare kicks off the championship week by providing players a number of health screenings, including a clinical breast exam. Joining us with more is Dr. Valerie Brutus, Director of Breast Surgery at Hartford Healthcare Cancer Institute at St. Vincent's Medical Center. Doctor, thank you for being with us.
Good morning. Thank you for having me.
Of course. Before we get into talking more about what's happening today, let's first start with this. What led to the breast cancer awareness on the golf course?
Well, I think we really have to thank Kim for sharing her story. She's one of the players been diagnosed with breast cancer, and she's quite young. And she decided to use this opportunity to share her story and also help other players and raise awareness about breast cancer.
Oh, that's wonderful. It's nice to hear that people sharing their journey, their story to inspire others, especially when it comes to our health and taking care of ourselves. Now, tell us about the breast cancer screening offered to the Epson players.
Of course. So today we'll be providing, first we're going to do what's called a breast cancer risk assessment, where we're going to ask players to fill out some information to determine their own risk. We're going to be educated about performing self-breast exam because we feel like people should be comfortable to know what their breast look and feel and be aware if there's a change to talk to their providers about it. And we'll have our team also performing breast exam for all the players.
Oh, that is wonderful and important for us all to remember to take care of ourselves and go for those regular screenings. Now, what other types of breast cancer screenings are there and what do you recommend?
So I think so for breast cancer screening, I think it's important that everybody at the age of 25 should have their own risk assessment done by their provider, because that will really help determine, who needs to be screened earlier or who can wait to have breast cancer screening at the age of 40. For the current recommendation now is that women who are at average risk for breast cancer should start to have mammogram at the age of 40. There are other exams such as breast ultrasound that can be added depending on the breast density. And also for players who are at higher risk, there are other exams such as a breast MRI that can also be added. So this is where understanding, what your risks are and understanding what the recommendations for you is extremely important.
Absolutely. And with those screenings, how regularly should we be getting them?
This should be done on an annual basis. Recommend that everybody at the age of 40 put average risk women to start annually. For players who are at increased risk, they can start, at 30 or even younger, depending on their risk factor. And that should continue until people are in good health or have a life expectancy of 10 years.
Wonderful. And Dr. Brutus, we have to ask, we see that you are live there joining us from the course. We know that the championship, it tees off officially on Thursday, but what is it like so far out there? How's the energy? It's a beautiful course, obviously hot today, so hopefully staying cool, but what's it like being there?
Oh, it's a beautiful day. It's a beautiful course. It's a great day. I certainly hope it gets a little cooler. But I'm so happy to be here. I had a chance to chat with Kim earlier today, and she's amazing. It's so courageous of her to share her story. All the players are here excited to start to play, and they're also, grateful that we are here to help them, and everybody's, of course, here to support each other.
Absolutely. Women supporting women. That's a beautiful thing. Thank you so much for joining us.
Thank you so much.
Of course.